From Studio 8A, coverage you can count on in high definition. This is KOMU 8 News Today.
Hello, and welcome to the 2012 edition of the Missouri Urban Journalism Workshop. I'm Kenneth Harris. This year's theme is health. The Affordable Care Act continues to be a controversial issue even after the recent Supreme Court decision. Lucy Fullerton from Germantown High School in Germantown, Tennessee, tells us just how much some Mid-Missourians know about the ACA.
It's a simple day at the beach. Belandria Robinson and her 4 children are enjoying some relief from the heat. But Robinson cannot forget all her problems.
With the job that I have, benefits and health care is not available to me.
Her 4 children are currently covered by Medicaid. However,
I'm not covered. So if I ever have to go to the hospital, I have to come out of pocket for it.
But Robinson, like so many Americans, did not know that she is required by the Affordable Care Act to get coverage by 2014.
Is that the thing Obama's working on?
That I know very little about. There are parts of it that I still don't understand.
Stan Hudson is the Associate Director at the Center for Health Policy, and he says he spent months reading the ACA.
The idea is that, with health insurance, the way it works is, you create insurance pools, and the more people you have in that pool, the more healthy people you're going to have who can then pay in. That will cover some of the sick people.
But even at this beach, Robinson is not the only one without health care.
With the bills that I have, I really can't afford the insurance that they're offering.
Jeremy Hurd works in Columbia and says that he doesn't think it's fair to fine him for not having insurance.
It's kind of a scary thought to think of having some sort of a medical emergency or something like that, when it's out-of-pocket expense, because it really hurts a guy, in my tax bracket.
Yeah, information about it would be helpful.
The more that are insured, technically, the better will be, because our healthcare costs won't be as impacted by that. Because when you're uninsured and you can't pay for the cost, then society ends up paying for that.
And accurate information, Hudson says, is hard to find in this political climate.
There's not a lot of open and encouraged debate about the issues.
And that is because many of these issues have not been solved at the federal level.
When the details of the changes are ironed out, then there will be education at the federal, state, local level.
I think you really got to approach it just one issue at a time.
Educating the public about healthcare resources that are available to them is very much a public health issue, because we want to make sure that people have access to health care.
But until then, people like Robinson will have to rely on a different type of support.
I just pray that nothing ever happens to me, that, ever get hospitalized or sick to where, I'd have medical bills that I have to take care of, because, there's just no way I'd be able to do it.
A simple wish about a complex issue. With the Missouri Urban Journalism Workshop, I'm Lucy Fullerton.
From fast food to the supermarket freezer aisle, food safety is always a concern. Aaron Suttleson of Allen High School in Allen, Texas, tells us about a controversy that's made many people ask, where's the beef?
It's a hot Missouri morning, and Brianne Abramovitz is working her summer job.
My dad and I do most of the labor out here, whether it's feeding or moving cows or working with them.
But for nearly a decade, a controversial meat process has threatened her industry. It's called lean, finely textured beef. It's processed to be lower in fat content than regular beef, but you may know it by another name, pink slime.
It's hard as a producer because now all kids that go through the lunch line, they don't like that perception of the hamburger that they're eating. And then parents don't like the perception of the hamburger that their kids are eating. And it creates a negative impact on the whole industry.
But a university professor says people's feelings get in the way of scientific facts.
Lean, finely textured beef is 100% beef. It is simply a result of a process of using a centrifuge to remove fat from beef and make it less fat and higher lean content, but it's beef.
It's that same type of beef that the Director of Nutrition for the Columbia Public Schools is keeping out of its cafeterias.
I basically called the Department of Education for Missouri and asked, are we involved in this at all? And they assured me no, that we were not.
And parents are relieved.
As far as I know, my daughter has never consumed pink slime, and I hope that she never does. If it came down to her eating the cafeteria lunch and me packing her lunch, I would in a heartbeat.
But why do people feel so strongly about a meat that researchers say is healthier to eat?
It's the name. Lean, finely textured beef is no problem, but the media and opponents like to call it pink slime, And pink slime is not a very appealing name for food.
The product is also treated with ammonia or citric acid to kill bacteria, and organic advocates don't like the idea of ingesting those ingredients.
We produce most of our own food, so we know where all of our food's coming from, and we see it from life to the table.
But you don't have to be a farmer to get the details on your dinner. Especially at organic grocery stores, you can actually tell where a lot of the meat is coming from. For example, this meat right here was produced in mid-Missouri. And the store manager says it pays to pay attention.
Just because something is on the shelf and it's being sold to eat, you know, chicken thighs for 39 cents a pound, I think that it's quite possible that you should put a little more thought into the process and think, if you're going to feed your body with this, what fed their body?
But back at the farm, Abramovitz trusts her industry.
I can't say that I really ever worry about the fact that my meat is safe to eat. I think that there's so many implications in the industry that like packers go through, restaurants go through. If they're following the rules and they're in business, then I shouldn't be afraid of the product that I'm eating.
With the Missouri Urban Journalism Workshop, I'm Erin Suttleson.
When you think of rehab, you may think of posh spas you see Hollywood starlets attending. But in mid-Missouri, they offer so much more. Natalie Zhang from Brigham Hills High School in Armonk, New York, found out how mid-Missouri treatment centers are helping those who are abusing drugs.
Heather Harlan, it's just another day at the office. But for those who go to the Phoenix Treatment Center, her help means so much more.
We as adults need to find unacceptable that we would let our young people play Russian roulette with addictive drugs.
Harlan is a prevention specialist at Phoenix, a center which helps addicts overcome any addiction. But Heather says she has seen a recent rise in prescription drug abuse, especially in teens.
According to the National Survey on Drug Use and Health, 1/3 of users aged 12 and over who use drugs for the first time began with prescription drugs bought at a pharmacy like this one.
It's drugs like Vicodin, Percocet, Oxycodone that can sometimes do more harm than good. And they're often the easiest to get. And some parents make it easy for their kids to get their hands on the drugs by leaving pills in medicine cabinets.
Blaming young people for experimenting with alcohol or other drugs is like blaming a fish for swimming in a polluted stream. We adults have created the environment.
And I think that's the biggest, is being parents that are with their children and teach and talk to their children. Or there's lots of parents that they have kids and they're never home. They're either working all the time, or they might have just one parent, one's working, and they're too many hours on their own, or maybe peer pressure.
Joanna Hayes is a mom and coach at the Mizzou volleyball camp.
More and more high school, and it will trickle down to the junior high and even upper elementary ages, because they are not very educated about it, or they want that quick high and they don't really know the long-term effects.
And she's not the only one who is concerned.
Now my 14-year-old is going to be a freshman this year in high school, so I'm very, very worried about it, because obviously peer pressure is something, you know, everybody has to worry about.
But Heather says there are steps a parent can take to prevent anyone from abusing prescription drugs.
And prescription drugs to take that very seriously, to lock them up, monitor them, count them, and when you're done with them, to dispose of them properly. Here in Columbia, we have a disposal site at the Columbia Police Department.
And some parents are doing just that.
My husband and I have a small safe. We have them in a lock with a key and everything, so that way they can't get into them even if they want to try.
To fight the drug addiction problem, there are many things parents can do to give hope. With the Missouri Urban Journalism Workshop, I'm Natalie Zhang.
What you put in your body is important, but how does healthy eating affect those that may need it most? Athletes. Kenneth Harris from Sparkman High School in Harvest, Alabama tells us how good nutrition gives athletes that competitive edge.
All the way down to downtown.
It's 5:30, and a group of Columbia residents are about to run 7 miles. One member of the Columbia Multi-Sport Club is up this early for that feeling she gets after she's done.
It's so hard to get out. Like, I get out of bed around 4:45, and it's hard. But then how I feel the rest of the day makes it all worth it. And I have to remember that early in the morning.
So what you get out of your body early in the morning depends on what you put into it. For the Missouri football team, nutrition is especially important.
Food-wise, we just try to make sure that they're getting protein in their body overall.
All that protein to get bigger muscles and more athleticism. It's not always easy for Heitmeyer to get the players to eat what she wants them to.
They're all addicted to McDonald's, and I have a very hard time convincing them that it's cheaper for them to actually prepare their own foods versus them going to McDonald's or Sonic or Taco Bell and purchasing a bunch of crap that only lasts for one meal.
But a lot of players are on board with healthy eating.
I think they all want to do it in their head. It's just a matter of, are they willing to put in the effort to do it? So sometimes we have to fight about it, but overall, I think once they actually try it, they realize how much it actually benefits them, and then they're more willing to do it.
The multi-sport club runners realize how much nutrition affects their sports too.
It's really important. If I have an off day and I eat a lot of sugar or I don't hydrate enough, then I have a really cruddy run. So, I mean, I definitely feel the difference.
With a little workout, Joe thinks you can cheat.
I think you've got to get all the good stuff in you, but then running also burns enough calories that it allows you to eat the desserts too.
Healthy eating and good exercise, a sweet combination. With the Missouri Urban Journalism Workshop, I'm Kenneth Harris.
Thanks for joining us at the Missouri Urban Journalism Workshop.
We hope you enjoyed our program.
For more information, go to our website at komu.com.
We'll see you next summer.